Does your child struggle with school? Do they fear reading out loud, writing an essay, or tackling maths? You may wonder what it could mean for your child's future, or worry about how they will make it through school. No parent wants to see their child suffer, and it is tough to face the possibility that your child has a learning disorder. A learning disability is a congenital impairment of the brain and cognitive abilities of a child. A learning disability is a neurological condition. It affects the brain's ability to send, receive and understand the information. A child with a learning disability will struggle to speak, read and write, pay attention and understanding the mathematical concepts, and generally struggle to understand anything. Learning disabilities are caused by genetic or neurological factors that alter brain function, and it affects one or more cognitive processes related to learning. No parent wants to see their child to suffer with learning disabilities. Here we see how to deal with the symptoms of different types of learning disorders. There are many different disabilities under the category of learning disabilities, for example dyslexia, dyspraxia, dyscalculia and dysgraphia. Each of these defects may be seen in combination with the others. Learning disabilities are not caused by physical illness, mental illness or economic status or cultural background, nor does it mean that a child with a learning disability is weak or lazy. A child with learning disabilities will manifest the difficulties in attention, speaking, reading, spelling, or math. Some children are slow learners, but after a while they learn to read and start doing their academic and other activities like everyone else. Some children may not be interested in learning certain subjects, or they may not be interested in sports and other outdoor activities. These characteristics indicate the child's interests and should not be thought of as learning disabilities. As a child develops normally, it must acquire certain basic knowledge and skills. A significant delay or gap in this development may be a sign of a learning disability. The sooner a child with a learning disability is diagnosed, the better, and child can be cured by giving proper treatment. If this condition is left unattended, the child may struggle to deal with his problems. What causes learning disabilities? It has been found that if the parents of a child have learning disabilities, then the child is also likely to have the same problem. Diseases that occur during and after birth, childhood stress, environment, ADHD and autism are known to have learning disabilities in children. Parents and teachers are the first to notice that a child is having difficulty reading, writing or learning. If you think your child may have a learning disability, consult a pediatrician for appropriate treatment. An integrated approach with homeopathic treatment for children can bring a great change in the development of the child. Homeopathic treatment is mainly for brain development, improving brain functions, increasing the child's concentration, and helping the child to connect on an emotional level and with the environment. For learning disabilities homeopathic treatment, you can contact Dr. Sheela Homeopathic Healthcare Clinic on the following number at 9500049892 for learning